Hello friends, welcome to Easiness where nursing education made easy. So today we are starting with community health nursing unit number 1. So we will discuss what are the important things that's coming in the unit number 1. So let's discuss one by one what are the important topics that will appear from unit 1 of community health nursing 3rd year GNM. So we'll start with the topics. First we'll see introduction. So what is introduction about the community? So here we will see about health administration. So what is the introduction about health administration? It's a branch of public administration which deals with matters relating to promotion of health, prevention of services, medical care, rehabilitation, delivery of health services, development of health, manpower, medical education and training. So it's administration, totally the managing of health administration through services like prevention, promotion of health, prevention services, medical care, rehabilitation, delivery of health services, development of health, manpower, medical education and training. So that is the branch of public health administration, that is known as health administration. So the purpose is to improve physical, mental and social well-being of people or individuals in the community, and it aims at preventive of disease, preservation and promotion of health. So mainly focusing on promotion of health and prevention of disease. So that's why health administration stands. So this is just an introduction about this chapter. So we are going to discuss about detailing what are the important things in this chapter. So first one is health organization as national level. So what the national level, the state in the Indian government at the national level, what are the health organizations available? It is Union Ministry of Health and Family Welfare. So the Ministry of Health and Family Welfare, Directorate General of Health and Service Central Council, Director General of Health Services and Central Council Health. So these are the main three categories: Union Ministry of Health and Family Welfare, Director General of Health Services and Central Council of Health. So we'll detailedly see about Union Ministry of Health and Family Welfare. The Union Ministry of Health and Family Welfare is headed by Cabinet Minister, a Minister of a State and a Deputy Health Minister. These are the political appointments. So by election, so conducting the elections in democratic India, we will select the members to Parliament, and through Parliament they will select the Cabinet Minister. So Union Ministry of Health and Family Welfare is under the Cabinet Minister along with a Minister from State and a Deputy Health Minister. These are the appointments. So it has two departments, that is it's mainly two departments, Department of Health and Department of Family Welfare. So health has separate department and family welfare has separate department. So this is Union Ministry of Health and Family Welfare. So functions of Central Ministry of Health include Union List and Concurrent List. So the functions is classified into Union List as well as the Concurrent List. So what is Union List? Let's see. So international health obligation. So it contains the international, it is related to the international health policies and obligations. Administration of higher central education, technical, vocational and research institute. So the administration or the building up or setting up of educational, technical and vocational or research institutes is one of the functions coming under Union List. Census and publication of statistical data. So the census taking by the government and also the publication of the statistical data is also a part of Union List. Interstate quarantine and interstate migration. So the interstate migration or the quarantine. So the quarantine period is famous. We can able to see at the time of COVID-19. So interstate quarantine and interstate migration is also coming under Union List. Regulation of manufacture and sales of drugs. So the emergency medicines, so the drugs that's needed, that's the regulation and the production of medicines. Also regulation of professional bodies. So these are the main functions of Central Ministry of Health include in Union List. Yes, so that is where this question will come for maybe a 5 mark or 10 marker, maybe a 2 marker also you will get this question, what the functions, and it is divided into mainly two functions, Union List and Concurrent List. Now we are going to discuss about Concurrent List. Through concurrent list, it is prevention of food adulteration. So the food adulteration or something is mixing up the food, the quality of food will be destroyed through that something of mixing up the food. That is what called adulteration. So food prevention of food adulteration, family planning and population control. So they will have the family planning services along with population control services. Prevention of interstate extension of communicable diseases. So from one state to another state, the communicable disease should not be spread. So that's why they will do the prevention through this concurrent list. Social security and social insurance, vital statistics and vital registration like birth date, birth rate, birth at the time of birth we need to do the registration, death registration, marriage registration. So that is coming under vital statistics and vital registration. Control of drug and poison. So the drug induced alcoholism like alcohol, other kind of drugs we will control through concurrent list. So these are the main functions of union cabinet. These are the main functions of a central government. So it is prevention of food adulteration, family planning and population control, prevention of interstate extension of communicable diseases, social security and social insurance, vital statistics and vital registration, control of drug and poisons. So it is mainly, so what it is we have discussed here, it is Union Ministry of Health and Family Welfare. That is the functions is divided into two types, union list as well as concurrent list. So now we will discuss about the second classification under the Union Ministry. So under the ministry what will come? It is Directorate General of Health Service, Directorate General of Health Services, DGHS. So the DGHS is the principal advisor of Union government in both medical and public health matter. So they will give DGHS person, that person will give the advice in medical as well as both in the public health matters to Union government. So they are giving the advice to the Union government about policies and services. So the DGHS is the principal advisor of Union government in both medical and public matters. The DGHS is headed by the Director General. So the person who is heading this, it is Director General, and DG is who renders technical advice on medical and public health matters involved in the implementation and monitoring of various health schemes. So the implementation or intervention of various health services in India, who will give the advice or who will monitor it? It will be the DG, Director General, through Directorate General of Health Services. So they will give the advices on policy making and services to the union government. The DG is assisted by the team Additional Director General of Health Services. So the DG, under the DG who will come? Additional Director General of Health Services, Deputy Director General, Assistant Deputy Director General, and a large number of other administrative staff in hierarchy. So what the hierarchy here? First is Director General. So under Director General there will be Assistant Director General of Health Services, under that Deputy Director General, and under that Assistant Deputy Director General, and a large number of other people also working in this Director General of Health Services. Yes. So we will move to functions of DGHS. It is International Health Relation and Quarantine. So it is working for the International Health Relation and Quarantine, control of drug standard, medical store, depot, postgraduate training, medical education, medical research, central government health scheme, national health programs, Central Health Education Bureau, National Medical Library. So these are the functions of DGH. So they will manage all these functions like international health relations and quarantine, control of drug standards, medical store depot, postgraduate training, medical education and medical research, central government health scheme, national health programs, Central Health Education Bureau, and National Medical Library. Next, we will discuss about the third category, that is Central Council of Health. So under the ministry, under the DGHS, it will come Central Council of Health. So the Central Council of Health was set up by presidential order on 9th August 1952. So it is under the order of, it is developed under the order of presidential order on 9th August 1952 under the Article 263 of Constitution of India. So for promoting, coordinate and concerned action between the center and the states in implementation of all programs and measures pertaining to health the nation. So what are the things they are doing? They are mainly doing implementation of all the health programs in India. Implementation of all the health programs, along with they have the measures for penetrating health of the nation. So the protection of health of the nation, they have measures. So that's why Central Council of Health is important. Central Health Council has other consultative and advisory bodies as a such as consultative child welfare, statutory and technical advisory bodies. So this is a Central Council of Health. So now coming to health organization at state level. Now we had discussed about the central level. Central level, the Union of Ministry of Family Welfare, Health and Family Welfare. Under that, DGHS, Director General of Health Services, along with along with the last one we had discussed is Central Council of Health. So 3 categories. Now we are moving to health organization at state level. So what are the state level? State Ministry of Health. So every state in India has State Ministry of Health. So the State Ministry of Health is headed by Minister of Health and Family Welfare and a Deputy Minister of Health and Family Welfare. So there will be a minister and there will be a Deputy Minister for this. Every state has in India, every state has a Ministry of Health. So it is headed by Ministry of Health and Family Welfare and a Deputy Minister of Health and Family Welfare. They have political responsibilities and they are elected members of Legislative Assembly. So they will be members of Legislative Assembly. So they are MLAs. After that, from the Parliament, they will be assigned as a cabinet minister. So they will be a minister. So they are a political responsibility. They are coming from basically a political parties and they have the political responsibilities and they are elected by Legislative Assembly. They have political appointments towards constituents as per the political agenda and responsibilities of administration and management of health and family welfare services in their states. So they have both the political and as well as the management of family welfare and health services in their particular state. So that's their responsibility. So that's why there will be one minister and there will be one deputy minister in both the department. So coming to health secretariat. So the second one in a state, it will be secretariat, and health secretariat is official organ of state health ministry. So state health ministry is working along with the secretariat. The secretary of the state government, senior officer of Indian Administrative Service, is administrative head and assisted by additional deputy and under secretary. So who will take care of all the decisions, or who will help or giving the advice for the government to make the policies? It is a IAS officer, and it will be a senior IAS officer who will be the secretary of state government. So he or she will be giving the advice on policy makings and services for the state government for health and family welfare. So next one is State Health Directorate. So next person involving in the state is State Health Directorate. The State Health Directorate has State Family Welfare Bureau headed by Additional Directory Family Welfare, also Health Family Welfare. So that person will be having a Health Directorate and has a State Family Welfare Bureau. The State Health Directorate is technical wing of the State Ministry of Health and Family Welfare. He also responsible for organization and direction of all health activities. So coordination and direction of all health activities is by State Health Directorate. The designation of Director of Health Services has been changed in some states and is known as Director of Health and Family Welfare. So it is known as Director of Family Health and Welfare. So these are the state level directorate. So coming to another important topic that's coming in the first chapter, that is Community Health Center. So what is Community Health Center? So Community Health Center is centers. We have a community centers in every community for the people, for the health of the people. It's by the government of India. So each CHSC has services in surgery, medicine, gynecology, pediatric, dental and ENT. So the CHSC will have a community health center will have every services, like what are the services they need to have. They need to have the services of surgery, medicine, gynecology, pediatric, dental and ENT. The services are rendered by a team of specialists, nurses and other personnel. So the director, we need here nurses, we need here other personnel and include the specialist doctors for this kind of services. And each community health center has 3 to 4 primary public health center. So under the CHSC, so there will be under the CHSC or Central Health Center, under the CHSC Community Health Center, there will be PHSC, Primary Health Centers. So a CHSC should have a referral center of PHSC. each community health center has 3 to 4 PHSC under them. So under the CHSC there should be PHSC and it should be have a 3 to 4 PHSC should come under the CHSC. Community health workers works as a referral center for PHSC to the area. So from PHSC, the patients who can't able to treat with the PHSC, they'll send to or refer to CHSC. So this is acting as a referral center. And at present, there are 3,215 community health centers according to 2005 in India. How many it is there? 3,250. Each CHSC has 30 beds. So this is community health center. Primary health center. So under the community health center, there will be primary health centers. PHS is an essential healthcare made universally accessible to all individuals and families in the community. So it is accessible to all the members in the community. That's why we need a primary health center. PHC has started in 1952 as part of community development program to provide comprehensive healthcare to people in rural areas. And the community development blocks covers approximately 100 villages, about 80,000 population. PHC consists of main building and 3 sub-centers. So one PHC, under that 3 sub-centers will come. So PHC is where the treatments happening. So if any treatments is not possible there, they will send to or refer to CHSC. So this is the primary health center. So sub-center. Next we will discuss about what is sub-center. Each primary center has 5 to 6 sub-centers. So under a PHSC there will be 5 to 6 sub-centers, and this is the first unit of health system for villages. So it is mainly seen in the rural area of India, where the villagers use the sub-centers. The sub-center covers population of 30,000 in general and 3,000 in hilly or tribal and backward areas. So it is in a general area, the population covering under sub-center is 30,000, and in the hilly area it is 3,000. So sub-centers are also the first unit of health system for the villages. Next important topic we will discuss in this class is Panchayat Raj from Unit 1. So what is Panchayati Raj? So the parallel of this official structure of administration, there is institution of local self-government in rural areas. So it is what called local self-government in rural areas. That is what called Panchayat. And this refers to Panchayati Raj system. The system is introduced in 1957. Strength and head. So from 1957 this is introduced. Panchayati Raj institutions are accepted as agencies of public welfare. So every panchayat is accepted as an agency of public welfare. So every state of India has panchayat. All development programs are channeled to this body. So the development like health development, basic sustainable development, everything is carried out through the panchayat. So this is also one of the parallel official structure of administration. So they also take out the health related matters. Also they will implement the health services that already indicated by the government of India. So Gram Sabha. So under Panchayat Raj there is one portion, that is Gram Sabha. It is an assembly of all the adult men and women of the village. So it is where Gram Sabha means nothing but the men and the women, the aged men, all that means like 18 years. After 18 years, the people, adult men and women, they will gather together like an assembly to take the decisions. That is what called Gram Sabha. The body meets at least twice in a year and discuss important issues and consider proposals for taxation. So twice in a year they'll have the meeting and they'll discuss about the important issues and they'll consider about the taxation policies also. And it discusses the annual program and elect the members of Gram Panchayat. So after the Lok Sabha only, in the Gram Sabha only, it will they'll discuss the annual program and also electing the members for Gram Panchayat. So this is Gram Sabha. So Panchayat Raj is also a 10 marker or a 5 marker question usually come. It is an important question. Coming to another important thing under Panchayati Raj, that is Naya Panchayat. What is Naya Panchayat? It is composed of 5 members from the Panchayat. So it is a group of 5-member people. They will come from the Panchayat and it tries to solve the dispute between the 2 parties or individuals over certain matters on mutual consent. So they will try to make a mutual consent between the parties. They are having a conflict with each other. That is why we need a Naya Panchayat. So they'll make the Naya. Naya means they'll make the decisions. So that is why it is Naya Panchayat. It is composed of 5 members from the Panchayat, and it tries to solve the dispute between two parties or individuals over certain matters on mutual consent. So from the both party, they'll agree to the mutual consent and they'll try to solve the dispute. Gram Panchayat. So it is an executive organ of Gram Sabha and an agency for planning and development at the village level. So the planning and development or sustainable development, the basic development, it starts from the Gram Panchayat at in the village level. It consists of 15 to 30 elected members. So the members will be there from each ward. Panchayat is under Gram Panchayat. It is divided as wards. From wards there will be each members will be there. That is 15 to 13 elected members. It covers population of 2000 to 5000. So a Gram Panchayat, it will be covering under 2000 to 5000. Every Panchayat has an elected president. It is known as the person elected member is known as Sarpanch or Mukhya or Sabhapati, and a vice president and a Panchayat secretary. So who will be the head, president, vice president and a secretary. So the Panchayat secretary has been given powers to function such as maintenance of sanitation and public health, socio-economic development of the village, etc. So who have the power here? The secretary. So the Panchayat secretary has different role compared to the president and vice president. What are the roles they have? They have the power to function such as maintenance of sanitation and public health, socio-economic development of the villages. So they will do, the Panchayat secretary will do all these works. So Panchayat Raj is one of the important question or important topic that is from this first chapter. So coming to next important thing we are going to discuss this class is integrated rural development. So what is IRDP, integrated rural development? Integrated rural development program was launched in April 1978. So Indian government has launched this program on April 1978 to eliminate rural poverty and to improve quality of life of rural people. So why it is needed? To eliminate rural poverty and to improve the quality of rural people. The familiar targets of program are agriculture workers, small cultivators, village artisans and craftsmen. So whom they are considered? They considered mostly agriculture workers, small cultivators, village artisans and craftsmen. They are provided with resources and skill, bank loans and subsidies by the government. So how they given the through IRDP, how they supported the farmers or supported the poor people by giving the resources and skills, bank loan and subsidies. So the IRDP is being implemented through District Rural Development Agency. So the district, from the district, every district in states in India. So it is through District Development Program, it is integrated. This integrated rural development program is already implemented. IRDP had initially taken up 100 development blocks and extended to 5,011 blocks on October to 1980. So it has first taken up 100 development and it is extended to now 5,011 blocks. So this is integrated rural development launched in April 1978, and why it is launched? To eliminate rural poverty and improve quality of life of rural people. Next, we will discuss about another important question or topic, that is functions of CHSC. So what is the function of CHSC or Community Health Center? Providing all preventive and curative health services, prevention of diseases and curation of diseases, treatment of diseases. Providing specialty services. What are the specialty? ENT, gynecologist, pediatrician or a physician. So that providing specialty services. Caring and supervision of concerned PHSC. So under this 3 to 4 PHS is working. So the caring and concern, so the management of PHC also is considered under the function of CHSC. Referring patients to teaching hospital and district hospital. So if they can't treat the patient or they need a much better care, they'll refer from CHSC, they'll refer to district hospitals or teaching hospitals like medical colleges. Providing reproductive and child health program. So MCH and maternal health and research RCH program. Implementation of all national health programs with active participation. So from where all the national programs by Indian government is implemented through CHSC. So these are the main functions of CHSC. So any doubts anyone is facing, you can ask this doubt. Otherwise, we will continue with the other functions. That's functions of district health organization. So what is the function of district health organization? Primary health care. So the basic health care, secondary and referral health care. So from secondary health care or referring, so the patient will be referred to another hospitals. Family welfare, national health programs, implementation of national health programs. Family planning and family welfare program. Family planning, PHSC, so the basic care. So these are the main functions of district health organization. Functions of primary health center. So what is the function of PHSC? What are the main function? Medical care. So the basic treatment, medical care will be given through PHSC. MCH, family planning and welfare. So maternal child health as well as family planning and welfare. So that is also one of the function. School health services. So through the providing school health services to the particular area. Improvement in environmental sanitation. Control and surveillance of communicable diseases. Control and reporting of vital statistics like birth, death or marriage registration. So this kind of things. Health education, nutritional services and immunization services like vaccine administrations to the pregnant ladies as well as the child. So these are the main functions of primary center. So through the PHSC, that this kind of services is given to people who are living in the rural areas. Services provided by sub-centers. It is maternal and child health services, family planning and welfare services, immunization services, health education and training and supervision of indigenous DIEs. So they will give the training for ANM or DIEs to take the delivery and as well as the performance of delivery procedures. So these are the main services provided by sub-centers. Yes, so we had discussed about all the important topics that may come from the Unit 1 of Community Health Nursing 3rd year GNM. So for the better explanations or for the more explanations and you want to study all the topics related from the syllabus, you can download Easy Nurse and you can subscribe to GNM for 3rd year. So till now we discussed about Unit 1. All the important questions. I hope everyone understood. So we will meet in the next sections with another chapters from continuing chapters. Unit 2 we will meet in the next sections. Till that, thank you.